Good morning. It's May 14th, and this is your daily brief in science. Here's everything you need to know. A 59,000-year-old lower molar from a Neanderthal shows a deep cavity drilled into the pulp chamber, indicating an intentional dental intervention rather than accidental damage. This finding suggests Neanderthals possessed advanced behavioral capabilities, including diagnosis, planning, and execution of procedures aimed at relief beyond basic survival. The evidence comes from the Chagarskaya 64 tooth and is situated within archaeological and anthropological context that supports deliberate medical care, per Washington Post coverage. Experts debate whether the drilling was self-administered or performed by another individual, with some proposing social support during the procedure. Future work aims to determine if the cavity was later filled with organic material to infer use of antiseptics or analgesics, and to identify similar practices in other Neanderthal groups. This discovery contributes to a broader pattern of Neanderthal healthcare, including the use of medicinal resources, challenging the notion that complex healthcare was exclusive to Homo sapiens. Scholars describe the finding as evidence of compassionate, skilled Neanderthal care, showing high-level manual dexterity, problem-solving, and caregiving in a cave setting. Microscopic analysis and experiments with Jasper tools reproduce the drilling and tissue removal, supporting intentional, non-random behavior. Micro-CT reveals grooves on the tooth walls consistent with rotation or drilling by a hard stone tool, aligning with an invasive procedure. Experts see cognitive convergence between Neanderthals and modern humans in adopting invasive medical practices and caring for those with injuries or ailments. The patient appears to have continued using the tooth afterward, with the procedure likely conducted by someone else, reflecting communal care rather than solitary action. The individual whose tooth was studied was an adult, and other evidence indicates use of toothpicks for cleaning, highlighting everyday health practices alongside medical intervention. A new Nature study of enamel proteins from 6 Homo erectus teeth hints at a genetic link that may connect H. erectus to Denisovans and to modern humans. The research shows 2 AMBN amino acid variants, AMBN A253G and AMBN M273V, suggesting a pathway of genetic flow across these groups in Asia during the Middle Pleistocene. Paleoproteomics is used to recover molecular information from H. erectus, and the work highlights sampling across northern and southern China to map molecular diversity and interactions with Denisovans. The team proposes interbreeding among H. erectus, Denisovans, and modern humans in Asia more than 400,000 years ago, with Denisovans potentially passing the shared variant to populations that later migrated out of Africa. Experts caution that ancient protein analysis is still in early stages, and interpretations are tentative, requiring more fossils and data for confirmation. Some researchers find the interpretation plausible, but note there is no direct transmission evidence yet, and that convergent evolution or independent origins could also explain the findings. Understanding relationships among early human relatives remains uncertain and depends on scarce fossil DNA, underscoring the need for more Homo erectus fossils and genetic material. Resolving how H. erectus relates to Denisovans and other ancestors will require additional fossil discoveries and molecular data, as species boundaries of the era remain ambiguous. The study uses enamel acid etch sampling, MALDI-TOF screening, LC-MS/MS analyses on multiple instruments, and data processing with MaxQuant, Peaks Online, and pFind to derive consensus endogenous sequences. Paleoanthropologists and geneticists emphasize molecular data's crucial role in confirming interbreeding patterns and the role of H. erectus in human origins. A key uncertainty remains whether the teeth are definitively H. erectus given isolated finds and atypical tooth shapes compared with earlier Chinese H. erectus fossils. The research team led by Xiaomei Fu calls for integrating proteomic data with broader fossil and genetic evidence to understand how H. erectus evolved into modern humans and its relationship to Denisovans. A large single-cell and spatial transcriptomic study of early-stage triple-negative breast cancer maps, cancer cell programs, and macrophage subtypes in the tumor microenvironment and links these patterns to chemotherapy response. Researchers trained a 13-gene panel into a machine learning model designed to predict chemotherapy response before treatment, signaling a path toward personalized diagnostics and therapies. The study profiled over 427,000 cells from 101 patients, classifying tumors into 4 archetypes based on cancer cell gene expression and validating these archetypes across datasets. Archetype composition correlates with NAC outcomes. ARCA2 associates with residual disease and poorer survival, while ARC3 associates with pathological complete response and better survival in external cohorts. 2 resistant cell groups emerged. 1 adapted to hypoxic conditions, and 1 with heightened immune signaling, with hypoxia-associated cells being particularly aggressive and tied to metastasis. Immune state profiling reveals TNBC-specific patterns. MAC-IFN and MAC-LIPC1Q are enriched in complete responses, while MAC-CCL, MyPro-LEAF, MAC-CXCL, and MAC-ECM are enriched in residual disease, with CD8-TECH linked to PCR and potential LAG3 and have CR2 targets. Stromal compartments are categorized into multiple states, including cancer-associated fibroblasts with interferon and ECM remodeling signatures, supporting the architectural link between archetypes and tumor microenvironments. 7 of 8 macrophage states associate with chemotherapy response. Macrophage subtypes tied to interferon signaling and complement are enriched in complete responders, whereas angiogenesis-associated macrophages are enriched in residual disease. Clinically, the findings point toward macrophage-targeted therapies and combination immunochemotherapy guided by the transcriptional landscape, though prospective validation is still required. Across datasets, archetype and metaprogram associations with NAC response are reproducible, supporting biomarker strategies to predict NAC outcomes and tailor therapies. 13 cancer cell metaprograms show differential abundance between PCR and RD, with M5 and M7 enriched in PCR and M6HLA higher in PCR-associated cancer cell subsets, indicating immune-related mimicry and stress responses. Future work includes validating predictive models in prospective cohorts, exploring chemoimmunotherapy contexts, and studying longitudinal evolution of cancer and microenvironment in relation to response and survival. A new study from Jiangnan University shows researchers genetically engineered E. coli to produce gadosol, a natural UV protective compound found in zebrafish eggs. They rebuilt and optimized the production pathway inside the microbe, achieving a 93-fold boost from about 45 milligrams per liter to roughly 4.2 grams per liter. The work, published in Trends in Biotechnology, argues microbial production could meet future natural sunscreen ingredient demand while reducing environmental costs tied to harvesting from nature. Gadosol is highlighted as a promising greener alternative, though there is no direct comparison with current commercial sunscreens, and questions remain about long-term safety, large-scale production, and regulatory approval. Context around gadosol emphasizes its role in protecting fish embryos from UV, its transparency, and ongoing interest in replacing harmful components in some sunscreen products. While gadosol's eco-friendly appeal is clear, substantial materials science and pharmaceutical formulation work remains before market-ready products can emerge. The research was funded by multiple Chinese science foundations and programs, with findings published May 13, 2026. Researchers anticipate the first gadosol-based products could appear within about 2 years, subject to further development and regulatory clearance, and some gadosol-containing products may reach the market in that window. Preliminary tests indicate gadosol has antioxidant activity comparable to vitamin C and may protect skin from UV damage, aided by a color-based screening test that rapidly identifies high-producing microbes. The method uses gadosol to neutralize free radicals, shifting a purple signal to yellow to flag higher-producing strains, enabling quicker screening of engineered bacteria. Gadosol's transparency and antioxidant properties suggest potential UV protection without the milky residue seen in some sunscreens. A new Nature study links sleep duration to organ-specific aging, showing that both too little and too much sleep accelerate aging across the brain, heart, lungs, and immune system using aging clocks built from multi-omics and imaging data. Using UK Biobank data from about 500,000 participants, researchers built 23 aging clocks across 17 organ systems and found a U-shaped relationship, with healthiest aging around 6.4 to 7.8 hours of sleep. Across outcomes, both short and long sleep are associated with a broad set of health risks, including 153 disease endpoints and higher all-cause mortality, underscoring sleep as a modifiable factor with wide health relevance. The Sleep Chart portal provides access to results, code, and summary statistics to enable transparency and replication. Genetic analyses reveal distinct architectures for short versus long sleep. Short sleep shows broad systemic genetic correlations, while long sleep links more strongly to brain-related traits. Mendelian randomization indicates sleep disturbances are more plausibly risk factors for disease than diseases driving sleep disturbances, though bidirectional effects can't be completely ruled out. 8 loci linked to abnormal sleep duration were identified, with short sleep enrichment in brain regions, while long sleep loci did not show such enrichment. The study, published May 13, 2026, is part of the Multi-Consortium, providing context with related references and prior work. Analysis shows relatively few genetic links to abnormal sleep patterns, highlighting environmental or lifestyle factors in sleep duration and its aging associations. The study does not claim a universal optimal sleep window or that sleep directly slows aging. Instead, it presents a comprehensive snapshot of sleep-aging interactions. Long sleep greater than 8 hours associates with increased biological aging burden and tends to have brain-centric disease associations, suggesting indirect or compensatory pathways rather than direct causality. Optimal sleep durations differ by sex across several bags, with brain prot bags showing strong associations and estimated minimums around 7.7 to 7.8 hours for females and 7.0 to 7.7 hours for males, depending on organ system. This has been your daily brief in science. To read more about these stories, follow the links in the episode bio. You can also subscribe to these updates via email at www.brief.news. For more daily podcasts about the topics you love, visit brief.news/podcasts. Tune in tomorrow. We'll be back with everything you need to know.